Have you ever wondered why your dentist insists on regular checkups and good oral hygiene? Well, the answer is simple, but its implications are far-reaching. You see, oral health is not just about having a picture-perfect smile or avoiding bad breath. It's a crucial component of our overall well-being. When we neglect our oral hygiene, we're not just risking cavities or gum disease, we're opening the door for more serious health issues like heart disease, respiratory infections, and even Alzheimer's. Yes, the health of our mouth is tied to our body in ways we're only beginning to understand. And that's why we're here today, to delve into the world of oral care, to explore its importance, and to learn how to properly maintain our oral health. Because a healthy mouth is not just about a beautiful smile, it's about a healthy life. Today, you'll learn how to take great care of your mouth and teeth. The first step to a healthy mouth is regular brushing. This simple act is the cornerstone of oral health, yet many of us may not be doing it as effectively as we could. So let's dive in and uncover the best practices. First off, it's vital to brush your teeth at least twice a day. Once when you wake up in the morning to kick off any plaque buildup that occurred overnight, and once before bed to remove the day's accumulation of food particles and bacteria. How you brush your teeth is as important as when you brush. Start by holding your toothbrush at a 45-degree angle to your gums. Use short, tooth-wide strokes to brush the outer, inner, and chewing surfaces of your teeth. Don't forget to brush your tongue to remove any lingering bacteria and keep your breath fresh. Now, you may wonder, what type of toothbrush should you use? While manual toothbrushes can do an effective job, electric toothbrushes are often more efficient in removing plaque. Whichever type you choose, go for one with soft bristles to avoid damaging your gums. As for toothpaste, choose one that contains fluoride. Fluoride is a natural mineral that helps to strengthen the enamel of your teeth, making them more resistant to decay. It's also a good idea to choose a toothpaste that's been approved by a trusted dental organization. Don't rush your brush. Spend at least 2 minutes each time you brush. If you're finding it hard to keep track of time, consider using a timer or a toothbrush that comes with a built-in timer. Lastly, remember to replace your toothbrush every 3 to 4 months or sooner if the bristles are frayed. A worn-out toothbrush won't do a good job of cleaning your teeth. Incorporating these practices into your daily routine can significantly improve your oral health. But it's just one part of the puzzle. Regular brushing needs to be complemented with other oral care practices for a truly healthy mouth. Remember, brushing twice a day keeps the cavities at bay. Next, let's talk about flossing. Yes, it's as important as brushing. You might be wondering why. Well, let's unravel the mystery of flossing together. While brushing cleanses the surface of your teeth, flossing goes a step further. It helps reach the nooks and crannies between your teeth where your toothbrush might not be able to venture. Flossing plays a crucial role in maintaining oral health as it removes plaque and food particles lodged between the teeth and under the gum line, areas often missed by brushing alone. This in turn helps prevent gum diseases and tooth decay. So, flossing isn't just an extra step in your oral care routine, it's a necessary one. But how do we floss correctly? It's quite simple, let's break it down. First, take about 18 inches of floss and wind most of it around one of your middle fingers. Wind the remaining floss around the same finger of the opposite hand. This finger will take up the floss as it becomes dirty. Hold the floss tightly between your thumbs and forefingers. Guide it between your teeth using a gentle rubbing motion. Never snap the floss into the gums. When the floss reaches the gum line, curve it into a C shape against one tooth. Slide it into the space between the gum and the tooth until you feel resistance. Now, hold the floss against the tooth. Gently scrape the side of the tooth, moving the floss away from the gum with up and down motions. Repeat this method on the rest of your teeth. Don't forget the back side of your last tooth. As for frequency, it's recommended to floss at least once a day. The best time to floss is before you brush your teeth at night. This ensures that your mouth is as clean as possible before you go to sleep. Flossing might seem like a chore, but it's an investment in your oral health that pays off in the long run. Remember, flossing daily helps to remove plaque and food particles in places where a toothbrush can't easily reach. So, let's make flossing a habit, shall we? Now on to mouthwash, an often overlooked but crucial part of oral hygiene. You might be wondering, why mouthwash? Isn't brushing and flossing enough? Well, think of mouthwash as the last line of defense in your oral care routine. It's like a superhero, swooping in to take care of any leftover bacteria that brushing and flossing might have missed. Mouthwash is more than just a way to freshen your breath, although it's great at that too. It can also help prevent cavities and gum disease, two common oral health problems. How does it do this? Well, mouthwash contains antimicrobial agents that kill bacteria. It's like sending a SWAT team in to take out any remaining bacteria that are trying to cause trouble in your mouth. Now let's talk about how to use mouthwash properly. It's not complicated, but there are a few tips to keep in mind. First, don't dilute it. Mouthwash is designed to be used at full strength. Second, use the right amount. Most mouthwashes recommend using about 20 milliliters, but check the label on your bottle to be sure. Swish it around your mouth for about 30 seconds, making sure it reaches all areas. And don't swallow it. Spit it out when you're done. When should you use mouthwash? It can be used at any time of the day, but it's especially beneficial after brushing and flossing. This way, it can get to work on any bacteria that might still be hanging around. One last tip. Not all mouthwashes are created equal. Some are primarily designed to freshen breath, while others offer therapeutic benefits like fighting gum disease or whitening teeth. Choose the one that meets your needs and don't be afraid to ask your dentist for recommendations. Using mouthwash can give your mouth a fresh feeling and help fight off cavities and gum disease. So next time you're in the oral care aisle, don't overlook the mouthwash. It's a crucial part of keeping your mouth healthy, fresh, and ready to take on the day. Finally, regular dental checkups. They are essential no matter how great your home oral care routine is. There's a saying that prevention is better than cure. And nowhere is this truer than in the realm of dental care. Regular visits to the dentist play a critical role in maintaining not just your oral health, but your overall well-being. So let's dive into why these checkups are so important. Firstly, regular dental checkups allow for early detection of oral health issues. This includes cavities, gum diseases, and even oral cancer. When these issues are detected early, they can be treated more effectively and often with less invasive procedures. If left unchecked, these issues can progress and lead to more serious health problems, such as tooth loss or significant pain. But what exactly happens during a dental checkup? Well, it's not just about poking and prodding your teeth. A typical checkup will involve a thorough cleaning to remove any tartar or plaque buildup, an examination of your teeth, gums, and mouth for any signs of disease, and sometimes X-rays to check for problems below the surface. Your dentist will also likely discuss your diet and oral hygiene habits to ensure you're doing everything you can to keep your pearly whites in top shape. So, how often should you be visiting the dentist? While it can vary depending on your specific oral health needs, a good rule of thumb is to schedule a checkup every 6 months. However, if you're at higher risk for dental diseases, your dentist may recommend more frequent visits. In summary, regular dental checkups are a vital part of your oral care routine. They provide a chance for professionals to evaluate your oral health, offer advice on preventive care, and catch any potential issues early. Remember, a regular dental visit can catch problems before they become serious, so don't wait until you're in pain to see your dentist. Make those regular checkups a priority. Your teeth will thank you for it. So, to sum up, good oral hygiene is more than just a beautiful smile. It's a commitment to your overall health and well-being. It's about maintaining that balance and harmony in your mouth that we've discussed throughout this video. Let's quickly recap. Regular brushing, preferably twice a day, is your first line of defense against most oral issues. It keeps your teeth clean and your breath fresh. Then we have flossing, which plays a crucial role in removing food particles and plaque from those hard-to-reach areas between your teeth. Next is the use of mouthwash. It's like an extra layer of protection, eliminating bacteria and freshening your breath at the same time. And finally, regular dental checkups. These are essential as they help detect any potential issues early. Remember, it's not just about your mouth, it's about your overall health. Follow these steps, and not only will your mouth thank you, but your overall health will too. Until next time, keep smiling. Eat